Hello everyone and welcome back to the new episode of Kidsy Rental Products Q&A series. The product of this episode is Kidsy Rotary Files, and we're happy to share that we have received a good response to this series and we have received several questions regarding the use of Kidsy Rotary Files. So this episode will be divided into two parts and I'm going to answer all the questions in these episodes. So let's begin this episode with question number 1. What are the typical speed and torque settings required for Kidsy Rotary Files? Basically, speed and torque are inversely proportional to each other. Torque is a measure of how much amount of rotational force is acting on that object and causing that object to rotate. That is torque. Adjusting the speed and torque can help minimize fracture and at the same time it increases the cutting efficiency. The recommended speed for Kidsy Rotary File is between 300 to 400 RPM, whereas the torque required is around 1.2 to 1.5 newtons. The clinical tip over here is try to use slow speed and high torque settings. This will increase the cutting efficiency and at the same time it reduces the fracture. Question number 2 is, which file is to be used in which canal and what is the procedure? So after achieving straight line access, vertical line determination and patency filing, we can start the shaping of the canals with Kidsy Rotary Files. For anterior teeth, shaping of the canals can be carried out with a single file that is size 44% file, which is color coded as black. For posterior teeth, we can divide it into three parts, that is narrow canals, medium canals, and large canals. Narrow canals are most commonly seen in mandibular first primary molar as basibuccal canals or maxillary first primary molar distrobuccal canals. For those canals, we can carry out the shaping with 24% file, which is color coded as yellow. For medium canals, which are most commonly seen in second primary molars, basibuccal, basilingual canals, those are medium canals. So those canals can be prepared with 25% file. For large canals, which are most commonly seen in the distal canals of second primary molars or palatal canals of upper molars, we usually use 34% file, which is color coded as blue. The clinical tip over here is do not force the file apically. Use the file in pecking or brushing motion 3 to 5 times per canal. Always clean the file after every insertion and irrigate the canal after every file. Question number 3 is, one file can be used for how many canals? One set of Kidsy Rotary File can be used for 30 canals. If you were to convert it into the number of pulpectomies, for anterior teeth, it will be 30 pulpectomies. For posterior teeth, it will be 10 to 12 pulpectomies, depending on number of canals. A clinical tip over here is, in case of narrow curved canals, it is better to use fresh set of files every time in order to avoid file separation and file fatigue. Thank you for watching and stay tuned for the next episode.